The following is the NutriMedical report, NUTRI medical report, Dr. Bill Deagle, USA Life, Liberty, Wellness Care Plan. Took a considerable number of years in practice and retirement and research, especially with my colleagues Dr. Ron Klatz, and reviewing other sources such as Senator Cassidy from the U.S. Senate and his 8-point plan to come up together with a unified plan that will incorporate all the good features that Dr. Price is trying to introduce as the head of Health and Human Services here under the Trump administration, and the following fully integrated system that will bring down costs and provide care for all Americans. A number of issues have to be dealt with that so far haven't been completely dealt with, and I'll cover those today in this presentation. You can contact me at NutriMedical.com or 888-212-8871, and I'll give my email at the end of the show as well. Firstly, we need to realize there's a number of issues that should be taken care of. We should be dealing with the issue of a value-added tax to replace insurance. We need to get rid of state licensure so that licensure is national, so that if you're in the military overseas or in a foreign base or a U.S. base that's overseas, such as in the Pacific, that we want to get rid of state licensure and have just a national licensure process. We also want to make sure the pathways, so there's no mediation and there's no malpractice, but just mediation. So that tremendous cost needs to be taken out of the health plan, so female physicians and senior physicians can still practice and can afford to practice, and that certain procedures aren't taken out of the ability of certain doctors to do those. My experience is one of the top female doctor neurosurgeons was not able to do certain procedures because the cost of malpractice was made it prohibitive for her to actually do the procedures, even though she was a top professor at the University of Colorado. We need to have lateral training pathways so medics in the military can take online courses and then go to centers of excellence and become surgeons. We need to have an ecological approach to life care, which includes everything from their food, water, GMO foods, vaccines, everything that can impinge on their health and their epigenetics. So that's important. We need to have centers for health, occupational, from birth to life extension care. Those centers should cover occupational medicine. The cost of producing a car, say in Ohio, compared to Ontario, Canada, is about $12,000 more on average, maybe a little bit more or less than that, depending on the size of the vehicle, mainly because of the cost of occupational care, so it should all be folded into one. We need to have step 1 metabolic and genetic testing. We can start off with quantum testing. Every home should have a QRMA machine so they can start quantum testing, and online questionnaires that they can answer with either their iPhone, iPad, etc. They can determine if they need to come in and have more advanced screening evaluations done. Step 2, we need to have lifestyle, exercise, diet, and environmental interventions, and there needs to be no barriers, cost barriers to doing these. We need to have special nutraceuticals like our NutriMeds we have at NutriMedical.com. And we need to have gene testing of all our citizens to find out where their genetic weaknesses are or their nutrient deficiencies in their diet or heavy metal toxins, so we can intervene early before they develop full-blown physical illness. And step 4, we need to make sure we deal with the ecology of clean water, air, food, scalar radiation from things like smart meters and Wi-Fi networks, near nuclear reactors that are often giving off radiation, and the downwind effect of things like Fukushima Daiichi, or ground levels of radiation because of the deterioration of the ozone layer, etc. So there's a lot of issues that need to be covered on an ecological basis. We need to start off with things like epigenetic and environmental testing, and then food, air, water, scalar radiation. So in other words, the environmental issues need to be taken into account. So if someone gets testing and their testing indicates they have heavy metals from, say, mercury amalgams, we need to deal with that, or eventually that'll cause neurodegeneration or heart failure and other problems, or if they have arsenic or lead in their system. We have the end effect, of course, is life extension. The years of healthy, productive life are extended, not the total life, the years where they actually may be dependent on a very expensive healthcare system. 5% of Americans use 50% of healthcare dollars, which is not good, and also doesn't necessarily improve the quality of their life while they're going through medical care or surgical care. We need to have wellness that works with families and society. We need to deal with genetic expression and nutrients. We need to deal with the epigenetic expression, and it creates a more stable society that has workers that accumulate skills and can work well beyond their so-called retirement years. Example is, basically we're looking at different times of the healthcare system. The healthcare system right now, if we look at the 10-point plan of Dr. Ron Klatz, point of care laboratory testing, defined as testing at or near the site of the patient care. The goal of POTCT is to allow more rapid and effective diagnosis and triage, leading to improved patient outcomes, reduce morbidity and mortality, and slash costs. So we need to have testing where they have, say, a QRMA machine in their home. They can easily go to a lab facility or have a mobile tech come to their home if they may be homebound. We need to have biomarkers for aging and health management. And billions of healthcare dollars are wasted on diseases that can be detected and treated early prior to their occurrence. Heart disease, stroke, cancer, type 2 diabetes, all kinds of conditions. Point 3, free biannual comprehensive metabolic testing. That includes things like, we have one company here in San Diego County that within 2 to 5 years will have all of the human genome possible for testing for under $100. Right now, for about $100, you can do a 23andMe and Prometheus analysis for $5, and it will give you tremendous amounts of genetic data to show you where your weaknesses are that may require extra nutrients that are activated, or weaknesses that can predispose to illness, such as APOE or factors that might predispose to cancer, or autism if you get stacked vaccines with heavy metals. We need to have metabolic syndrome costs. If you look at these tests, they could slash a lot of these illnesses by cost by 20% or more. Significant given that metabolic syndrome is a primary cause of cardiovascular disease. So just looking at diabetes alone would make a huge difference. Point 4, telemedicine consultations. These are possible basically anywhere in the world. So if you have complex illnesses, you could have a telemedicine expert intervene. We should have also clinics where, say, there's one doctor, 5 or 6 nurse practitioners, chiropractors, psychologists, geneticists, etc., and a clinic where rehab can be done as well. Point 5, and of course 24, the telemedicine provides access to medical professionals for residents of remote areas, people with limited mobility, unclogs the emergency rooms for non-emergent patient, and creates jobs for people who are only able to work via telecommuting. Point 5, aging intervention drugs, and we're talking about nutraceuticals. We have a lot of nutraceutical technologies now, and anti-aging peptides from the Russian Academy of Sciences, and anti-aging stem cell therapies that are coming online. And many of them will have an enormous impact on the populations, not only over 65 but younger, and preventing chronic lung disease, ischemic heart disease, stroke, lung cancer, pneumonia, and gastrointestinal illness. Point 6, stem cells and nanotechnology. Everybody in the country should have their stem cells stored in a bank, so if they have a serious health problem, they can recall their stem cells and have them multiplied to help fight cancer or regenerate organs, etc. Biomedical technology has exciting potential for significant improvement in cures such as 3D organ printing of a damaged or destroyed limb, or replacement heart using ghost heart technology developed at multiple centers in America. In the next several years is going to yield the capacity of organ replacement with the patient's own organs and stem cells. We need to look at things like Alzheimer's, Parkinson's. Many of these you have to think of the individual in America right now. With the veterans' bills in health over 100 years ago and the EMTALA laws of 1987, there is an entitlement to health care, but it's not rational financially. So as a result, we're very wasteful. We don't actually intervene in the illness, and everybody's literally like walking around like a debt coming due. And as a result, it's bankrupting the country, hamstringing our industry. Obamacare was a good example with all the mandates, how it destroyed a lot of the economic growth in the last 8 years. Point 7, personalized genetic testing and nutrigenomics. Making these resources widely accessible allows for prospective identification of major disease processes, including heart disease, cancer. If you have questions regarding information in these press releases, please contact the company listed in the press. And of course, that's A4M, the American Academy. And you can go to WorldHealth.net, that is, worldhealth.net, and I can get you the contact of Dr. Ron Klatz and Dr. Bart Goldman that actually has known Donald Trump for 35 years. The main thing, of course, is you're able to do testing that can intervene and prevent illnesses of many kinds. Point 8, free subsidized access to gym, spa, metabolic detoxification. In many industries, including the military, may detoxify someone, say, with methyl ethyl ketone or heavy metals, or depleted uranium if they're near a site where DU munitions are being used. Obesity, of course, is a major cause, but obesity is a metabolic disease caused by high insulin. That's another epiphenomena of free radicals that cause an increase in insulin resistance, and the increase in insulin resistance not only causes diabetes, but obesity is a sign of elevated blood insulin levels, storing calories in white fat rather than brown fat that can be burned off. Point 9, online electronic database of anti-aging interventions and free medical education resources by promoting practitioner patient education. So everybody should be on online education and maintenance. So we don't have malpractice, we have maintenance of practice styles. We also allow lateral training, so a nurse practitioner can be trained up to become an obstetrician, or a medic can become a surgeon, or someone can move up the ranks by studying the database and get what we call lateral access, so they can start off as a massage therapist to become a primary care doctor or nurse practitioner. Point 10, World Center for Anti-Aging Medicine. We need a center where we have excellence, where we look at advanced technologies so we can start getting a larger percentage of the population there that fit well at over 100 years of age. And this will happen. We're probably no more than 5 to 20 years away from what's called zero senescence, or the possibility with all the interventions we have coming that people will be able to reset their aging pattern or reverse it, regenerate organs, and actually reverse the whole process we call aging, which is 90% of illnesses we have nowadays are actually due to aging of different organ systems caused by a lack of nutrients, genetic abnormalities, toxic load, and stress of all kinds, including electromagnetic and radiation stress or emotional stress that's not dealt with. While prior administrations have failed to properly consider the value of shifting from a disease-based healthcare to an advanced preventive-based cost-saving platform, the new administration has all the opportunity to change course. Elected leadership should implement the comprehensive plan immediately to reduce skyrocketing costs and improve the quality of all of our lives. I use the term on my radio show, the NutriMedical Report, currently on Republic Broadcasting, from 12 to 3 Central Time, that's 10 to 1 Pacific and 1 to 4 Eastern, Monday to Friday. You can access through NutriMedical.com. I often say that we're going to replace Obamacare with embalming care, which is still disease-based medicine. It's still extremely expensive, so it won't fix the cost problems, because you don't fix the big pharma, big medica, big malpractice, and big insurance costs. And as a result, it doesn't intervene to actually lengthen lifespan. So you're paying more for less, as Bill Clinton said recently about the failure that they were getting of the plan for new health care. New Health and Human Services Administration must help Americans get true, proven preventive care and encourage healthier lifestyles. And you got to think of everybody in the country as almost like a debt coming due. If people take care of their health and they live to be 145, and they die quickly and don't spend years in the hospital consuming tremendous amounts of money on more expensive interventions. And the insurance carriers, of course, we need to get beyond insurance. We need to get beyond malpractice, beyond state licensure, where state licensing outfits actually harm or prevent advances in medicine. We also need to make sure we collaborate across specialties. So geneticists and stem cell clinics and naturopathic doctors and surgeons can all cross-collaborate to improve the epigenetics and the healing capacity after, say, a surgical procedure or trauma. Bill Cassidy, of course, is the doctor and senator that has now the job between now and the fall of 2017, and his colleagues to create a health plan. And this is part of his health plan, which is called 8 Steps to Healthcare. Patients have the power to choose a health plan that they make sense for them. So some young people might just want catastrophic insurance, so that should be their choice. A young woman in her 20s will have very different health needs than a man in his 70s. Instead of Obamacare's one-size-fits-all, patients should be able to choose the plan that most in line with their needs. Now, I think we should have a preventive plan with that. So if you have preventive centers, you could pay for those with a value-added tax, and you could have catastrophic insurance, and you can have stabilizers to make sure that consumers that and this is the number that I've heard from Reince Priebus today on the Fox News Network show with Chris Matthews, that about 179 million Americans already have health insurance from their employer, and there's no, how can I say it, selection against them because of pre-existing conditions. Another large number have Medicare and Medicaid that wouldn't be affected by pre-existing conditions. So it works out to be about 9 million that might not have insurance to be qualified or lost their insurance, and they need to have a buffer, which they've set up already now with a House bill, which will probably be strengthened even further by the Senate. But beyond that, that's for mainly catastrophic things, where if you have a major surgery or intensive care unit or something else, and you still need to have that, you need to have preventive care. So you need to combine the preventive care with this plan that Dr. Price and Dr. Cassidy is talking about. Consumer-driven health care, HSAs. You plan on having more detailed information on a plan for consumer-driven care in the healthcare section. Consumer-driven plans such as HSAs proven a remarkable health tool. So they could buy technology for keeping you healthier, and or exercising, or whatever you need, and there are devices to do exercise at home, like a treadmill or whatever, or supplements. And I believe in a combination of supplements and a minimum amount of drugs are helpful. For example, if someone has heart failure, the new drug Entresto is a miracle drug if you don't have 1 in 200 has angioedema, at stopping admissions to hospital. But there's a number of nutraceuticals that can work with that to reduce the plasminogen activator inhibitor 1, blood viscosity, and other markers that are going to cause plaque formation. So the combination of nutraceuticals like our NutriMeds and specific drugs that are safe and full knowledge, so people are fully informed about not taking drugs that are unsafe, they will cause problems or there'll be a price for them. Consumer-driven plans will then allow you to decide for yourself what you want. It's like a menu, and you're the patient becomes the driver, and the health providers get more information available that's through online continuing education, and they have to maintain that rather than as a counter to the idea of malpractice. So you constantly test them to see if they have a master of the knowledge base as it's moving forward. Consumer-driven plans such as HSA proven remarkable health care tool. They lower costs and give patients the power to control the healthcare dollar. Provides a financial incentive to be discerning in your healthcare dollars are spent. Also means you're probably more likely to change your diet, change your lifestyle, and select better foods, and become more aware of things that are bad for your diet that are going to harm your health. So, for example, if you're gluten sensitive, you may not have full-blown celiac disease. You're going to avoid things that are going to increase risk of problems, and you're going to be aware of things like if you take 2 weeks of antibiotic, it destroys your bowel bacteria and increases your risk of bowel cancer. So you're going to avoid the overuse of antibiotics that can create resistance. You're going to take nutraceuticals and a lifestyle that's going to promote heart health, especially if you've already had something done like put stents in because you had blocked arteries, or changing and making sure you adhere to the treatment protocol if the doctor's giving you a specific medication that's safe, and interact with the nutraceuticals to make sure that you do well. And you can do both quantum and functional medicine testing to identify if whatever you've done actually works, and that's where we get into functional medicine. The HSAs give patients the opportunity to receive more value and better care for the dollar spent on healthcare. So that makes sense. Transparency in pricing. Yeah, there should be a transparent price, because you can be living in, say, North County, San Diego, where I am, and you can have prices that are all over the map for the same procedure in a similar hospital setting with the same kinds of surgeons, with the same kind of, and there needs to be some transparency so that people can select. And you also have to realize that there's no incentive for the insurance carriers to look and try to drive the prices lower overall, because they almost take a percentage, like the mob takes a percentage. So you want to increase transparency to increase the use of consumer-driven health plans. And of course, once you have cross the state competition, it's going to drive the cost of healthcare down. Eventually, of course, it would be my idea that we need to transition eventually to a full no insurance carrier at all, but we should have these health, if you call wellness clinics, set up as soon as possible, integrated with Dr. Price and Dr. Cassidy's Senate plan for healthcare, because you're going to still need hospitals. I'm trained as a surgeon, intensivist, burn unit doctor, and I can tell you you're still going to need these, but you want to control the cost of malpractice, drugs, big medica, which is big hospital systems like Health One Columbia, and have cross-state competition. and make sure that no one is left out, like people with pre-existing conditions. And you want to have states should be encouraged to create informational portals in which healthcare customers could access about different healthcare plans and costs. And apparently Utah's done a bunch of this. Should also have a free market rather than a tool for government regulation like Obamacare. So the government should not think of it as a way of regulating the people or forcing vaccines or having, quote, standards of care, which actually may not be advancing to the art and science of medicine by actually harming patients by forcing a specific standard of care. And we see this happening in state licensing authorities where some groups that are affiliated with the state licensure try to persecute other surgical or other groups, mainly for business reasons, but they'll use the punitive action of state boards to actually go after doctors. A good example is Dr. Brzezinski at the Brzezinski Cancer Clinic that has anti-neoplastins and gene-based cancer treatment, and for years was persecuted by the FDA. Now the FDA has been doing research for the past dozen plus years, and larger cancer clinics are looking at gene-based off-label use of various medications to turn off the genetics of the cancer testing. So there's a good example that there can be some business persecution that can come through state authorities. Guaranteed renewal. Patients want to know that they're protected once they buy health insurance. So if they buy it, they can't get knocked off, especially if they get a new health problem. And of course, we also see that we want to preserve the family. Obamacare penalizes marriage. So if for certain couples, the government provides each person a subsidy if they are single, but does not give the same couple a subsidy if they are married. So that needs to change. That's really not reasonable. Marriage and family should be incentivized rather than penalized by allowing married couples to get the same subsidies that similar situated non-married couples get, and allow family members to pool their health care for family coverage. So that's important. You want to allow insurance plans to be sold across state lines. It's already been talked. This is stage 3 of Dr. Price's plan, Health and Human Services. The key to decreasing costs and increasing quality of care is incentive competition so that plans and providers have to compete harder for your business. Allowing insurance plans to be sold across state lines would increase competition. Tort reform. Doctors spend billions of dollars on extraneous tests and healthcare services. 80 to 85% of lawsuits are frivolous or of no basis. And in fact, the doctors that get involved with malpractice could be identified early with online testing and then retrained and have mediation to deal with them rather than waiting until there's either a body count when they harm people or a number of people that get harmed permanently and die. So that's important. America needs tort reform so they can reduce healthcare costs. And unfortunately, both Republicans and Democrats have had associations with the attorneys that have kept the costs really high. In some states like Oregon, there's no upper cap on the size of the malpractice suit, so it's pretty ridiculous. Now, integrated anti-aging functional occupational health care clinics, these can be set up right away parallel to the health plan that Dr. Price is wanting to put in. And they could gradually grow in size and scope, but they could cover work comp, they can cover all the things you mentioned about in terms of quantum testing, functional testing, and so on. And you start off with a small VAT. The money from the value-added tax should go to the county, not the state or politicians or groups of doctors or corporations or insurance carriers. It should go only back to the county, be managed by patients and by health providers, including doctors, naturopaths, geneticists, psychologists, etc. So that's how it should work. It shouldn't be a political football. Now, if you look at the mean average wage, for example, we should also move to a hourly wage away from fee-for-service. The massive processing of healthcare, including even in socialist countries like Canada and Britain, drives the cost through the ceiling and also tries to get government or the regulatory authorities to tell doctors how to practice medicine. So standards of care actually stifle medicine advancement and try to make one size fits all. It's very dangerous. And you could give a better salary with time off for studying, vacation, and continuing education to health providers. It would be less stressed because the average male doctor in America only lives into their mid-50s. So this needs to be fixed. He also excludes and persecutes female physicians or elderly physicians who either can't afford the malpractice or if they want to work part-time, like say a woman wants to work 3 or 4 days a week, half days, or a doctor decides because of health problems or other activities they're doing, they want to only work, say, they retire at, say, in their mid-50s or 60s, they should be able to work part-time. And right now, because they're not paid an hourly wage and they have to pay malpractice, they can't. We want integrated anti-aging occupational health care. This will save a ton of money for business. So if business immediately had access to occupational type doctors at these facilities, which could be started almost immediately across the country based on a VAT, it would take the immediate burden of occupational medicine costs away from businesses across America. So a large chunk of the reason, besides regulatory costs that prevent American manufacturers from competing with other countries like Canada or Mexico, is simply because the occupational costs are enormously higher here. And that could be fixed immediately. So integrated anti-aging would be highly improvement, would be more effective, prevent conflict, equal access, maintain sustainability. Ultimately, it get rid of local egos of health providers and other people, and there's a reason for cooperation that would be very helpful. Integrated would be safe and competent, and you'd have no state licensure, national licensure only with competency boards, and you allow lateral training, so you can start off with a medic who is very competent, but they can't even ride in an ambulance now, and they should be trained up to be a surgeon, for example. We would have an aged well population that are fit. We'd have wisdom and extended families, which means you have grandparents or great-grandparents. You'd have stable communities because you have people working well beyond their so-called retirement age. And you wouldn't be consuming healthcare dollars because these people would still be out walking or doing other activities and keeping their health up well into their 80s and 90s and so on. So we're soon going to have an aged population in the next, say, 20 or 30 years, where a larger and larger minority of the population will be 100 years of age and will be fit and mentally fit as well. It would also lead to more ecological stability because you'd have people that paid off their homes. You'd have people volunteering to do all kinds of work because they don't have any further debts. And you have more stable families because you have an extended family. So if you look at some of the effects, there are less health debt for the nation, which is a major cause of debt. Probably 20 to 30% of the debt in the nation is health, and it's going to increase because the population's aging, especially in places like Europe or North America. You increase the number of life years instead of death years. I call death years meaning the years where you're sick and consuming lots of health dollars and can't work. We'd be monitoring your health index with all these fancy tests we do, like QRMA, metapathia, blood, urine, stool imaging, other tests, genetic tests. We'd have a more disease-free population. We'd have more stable families because one of the other health providers and breadwinners would be stable health-wise. We'd have less mental illness, which causes crime, because most people don't see crime as a form of mental illness. And we would have less activities such as gang violence and other things because we have more stable families. So we'd have lots of positive effects that you wouldn't see right away. We'd have more productive years, so people who've got skill sets, say in their 60s, still could be working in their 70s and 80s and 90s. And that will happen. So we have artificial intelligence online, questionnaires that can be done even for your iPhone. We can have testing at these centers. We'd improve people's age score, and we'd have optimized life extension. So if you have any questions, do contact me, Dr. Bill Deagle. I'm a member of the American Academy of Environmental Medicine, American College for Advancement in Medicine, the American Academy of Anti-Aging Medicine. I'm retired as a family internal medicine doctor with CCFP, ABFP, ACOEM, and ABIME. I'm a medical legal expert. I still do consulting for medical legal cases, and I train and teach doctors all over the world on a daily basis for consultations and pretty well every specialty. I work with biological dentists, with surgeons, with alternative medicine doctors, etc. And this is my email, drbilldeaglemd@gmail.com. The phone number to NutriMedical is 888-212-8871. The website is NUTRI, like nutrition, NUTRImedical.com. And I did this in research with Dr. Ron Klatz, who I had many discussions with, and his colleague Dr. Bart Goldman's founding A4M, American Academy of Anti-Aging Medicine, and information from other sources such as Dr. Cassidy's 8-Point Plan and many other sources. I went to medical school from 1973 to 77. I was in practice from 1977 to 2004. I've been retired doing consulting, multimedia research, radio, television, and teaching all over the world health providers since that time. So I believe this plan, integrated with what Dr. Price is trying to do in the Senate with Dr. Cassidy and his team, would provide another layer of healthcare that would cut our occupational costs, have a more healthy population, and give a lot of strength back to the people and the health providers. We would eliminate malpractice, insurance carriers eventually. It wouldn't happen right away. It would take years to do that, but eventually. We dramatically and almost immediately cut health costs for manufacturing in the United States or other industries. And we would make ourselves not only more competitive, but live longer, improve the ecology of homes, families, food, water, air, etc., and be a leading nation to try to show what healthcare should be in the 21st century. So thank you for listening, and again, if you have any questions, do contact me, Dr. Bill Deagle, and here's my contact information. Thank you for listening, and take care. Take action. Again, my show is at the NutriMedical, N-U-T-R-I Medical. I have a YouTube channel, Facebook, Twitter. We simulcast to multiple platforms, usually every week, several times a week, with all kinds of experts, geopolitical, financial, health experts like Dr. Ron Klatz and other physicians. And we try to provide the best quality information that integrates the best of medicine and surgery, epigenetics and functional medicine, and the best of geopolitical. I'm a pro-life Christian activist and believe that we need to be pro-life from conception to the well elderly, and we should not have death panels. We should not exclude based on pre-existing conditions, and every American or even visitor to America should be treated with great respect. Thank you for listening, and God bless America. May we be a shining example to the world of what healthcare should be for our citizens and for people that visit.